Good morning. So my name is Alex, and as Wright said, I work in Melbourne with Harry and herself. And I'm going to be presenting on a survey that we recently carried out with our membership last month. And so we specifically asked about things such as, what do you want the future of the organization to look like? So I'm going to talk about the survey that we did very briefly and a little bit about the respondents that we had. I'm going to talk a little bit about our current aims and objectives as they're stated and the respondents' comments on those and their suggestions for improvement. And then I'm going to talk a little bit about the organization options that we presented to the membership and their comments and preferences about what they would like to see the movement be structured as moving forward in the coming months and years. So to begin, our survey consisted of 20 questions. We asked the respondents a little bit about themselves, their age, their professional affiliation. We asked them to comment on our aims and objectives, about what they thought we could improve on, whether they agreed with them or not, and about their preferences surrounding the future organization of the movement. We also allowed room for general comments and questions, and those are things that I've integrated into the presentation. We sent this email campaign to our email list of membership, which is about 4,000 recipients, and we also advertised it on the MGMH website, as well as various social media platforms via CIMH and MGMH. We had 279 respondents altogether, and 273 consented to complete our survey. We had respondents from 60 countries, which was very exciting. And as you can see, the majority of respondents came from the United States, the UK, India, and Australia, although we had pleasing representation from various low and middle income countries, including Ghana, Pakistan, Bangladesh, and Nigeria. Although in the future, we would like to see an increased representation from South America and Africa, where many countries only had 1 or 2 respondents, and we would definitely like to see new representation from regions such as Eastern Europe and the Middle East. We had an excellent spread in terms of age groups, representation from all the age groups that we identified, and primarily from the 30 to 39 age group there. And we had an almost even split in terms of gender. 51% of our respondents self-identified as male. So as I'm presenting the majority of the survey results here, the main question I'd like you to keep in mind is, do we change or do we stay the same? And when I say do we change the legal structure and the overall organization of the movement from what we currently are? And to be clear, what we currently are is a loose international network that is primarily and almost exclusively based around a website and a very large email list. So what are our current aims and objectives? Just to remind you, in case you haven't been to the website lately, the movement aims to improve the availability, accessibility, and quality of services for people with mental health disorders worldwide, especially in low and middle income countries, by scaling up services based in scientific evidence and human rights. And when we asked the respondents whether they agreed with these aims and objectives, it was very exciting to see that 95% of them did. Yes, these are excellent objectives. However, when we opened it up for open-ended comments, we had 171 comments about, although we agree, these are some things we think you could improve on. So we went just slightly too far. And these various comments can be categorized in 3 ways. One is terminology, which I'll talk about now. The second is conceptual framework. And the third is items for action. So first, we have terminology, and this is something that we can consider now in our discussion that we'll have immediately after this session. The main comment, or the main theme that came out of the terminology comments, was including a consideration of cultural appropriateness or cultural sensitivity, including an explicit recognition of context-specific community needs. So this is something to be thinking about. Other comments were much more specific, as you can see in the second and third points, where specific substitutions are recommended. So please keep these in mind. One of the other comments, or multiple comments, surrounded the theme of explicitly recognizing the recovery movement or recovery approaches. And other key words were brought up in various comments that we had. So these are things that you can consider just adding or incorporating into the aims and objectives as they currently stand, including things such as equity, affordability, appropriateness, and so on. So So the second category we classified as conceptual framework, and these comments were surrounding a framework that could be the foundation for the activities that MGMH would engage in, how we prioritize our various issues, and how we engage with the global mental health community. These are the themes that I took out of these comments. Many comments were surrounding having an increased role in awareness raising and advocacy. And this was both in terms of engaging with the public and general society, but also with government and being able to intensify our call for action on prioritizing mental health. The reduction of stigma came up multiple times, particularly in overlap with an awareness-raising role. And empowerment came up multiple times as well, but that one was specifically to do with the empowerment of individuals when it was raised. The theme of equity also came up various times, but from various perspectives. The main item that came up in the theme of equity was the question surrounding where should we be focusing our efforts. In our current aims and objectives, we primarily focus on low and middle income countries. The general consensus that came out of our membership comments were that actually there are vulnerable populations in countries of all income groups, and that excluding upper middle or high income countries was not something that the membership was interested in. And in fact, they wanted an emphasis on the vulnerable populations that can be found globally, and this includes people in low resource areas of high income countries, in emergency settings, and indigenous populations. So a very inclusive set of comments that really wanted to emphasize that we are not excluding people based on the income level of their country. The other perspectives that came out of the equity theme were comments surrounding, say, gender and the needs of women, but also from legal perspectives, where perhaps we should be focusing our attention on countries that have yet to develop and implement mental health legislation. So these are pieces just to keep in mind as we discuss later. The third and final categorization surrounding the aims were action items. And as you can see in this slide, I have split this up into things that are feasible now, given our current capacity, time, and financial resources, and items that require more resources than we have now and would not be feasible to move forward with at this point. So, for example, position statements, such as the one that we're going to discuss later with Dr. Eaton, these are things that we're able to do now. And we are also able to continue raising awareness in the best way that we know how, through our website and through events like this. However, it's clear that the majority of the comments and the suggestions for action that our membership would like us to take are beyond our current scope. And this includes things like establishing regional and country hubs, supporting research in low and middle income countries, engaging in service delivery and professional development. These are excellent ideas. However, they're absolutely beyond the capacity that we currently have. And so these are things to take with you as I begin to talk about the structure of MGMH. And if we would like to take this kind of thing on, we're going to need a different structural framework for the organization itself. So within the survey, we presented 3 different options to the membership. The first was no change, stay as we are, loose international network, an association, or a charitable organization. And we outlined the benefits and challenges of implementing each and what you could expect from an organization that would have that type of structure. Benefits of no change, obviously, there's very little to be done. We continue as we are. However, our biggest limitation is that we cannot collect funding, we cannot increase our human and financial resources, and thus we are very limited in the activities that we're permitted to engage in. The other 2 structures are able to get around that limitation. We would be able to collect funds, we would be able to develop a work strategy that would reflect the membership comments. However, that type of transition will obviously be lengthy, it will take commitment from a large group of people, and it will absolutely take financial resources. So again, things to keep in mind as I present the preferences based on these choices of the membership respondents. I'm going too fast. So what we asked first was whether each organizational option was suited to our current aims and objectives. Now this slide here actually can be split up into 3 different questions, which is why the percentages don't add up. First we asked, is our current state, or no change, suited to our aims and objectives? And 52% of our respondents agreed that yes, no change, and staying as a loose network would be suited to achieving these aims and objectives. This also means that 48% do not think that this is suitable for achieving the things that we would like to. In contrast, 63 and 65% thought that a transition to a different structure would be more suited to achieving these aims. We then asked respondents to rank, in terms of their preference, what they would like to see the future of MGMH look like. This slide reflects all the first preferences, so ranking number 1, this is what I would like to see. 30% said no change is fine with me. We would like to see it still inclusive and flexible and very much a grassroots group of people getting together and talking about something they're passionate about. However, 70% said that they would like to see a transition made. And this is aligned with the general comments that we had as well in terms of the governance. So things such as having an appointed board, having a constitution, and better clarity about how we make decisions and being able to collect funds and apply those to our work. These are things that are much better suited and in fact would be impossible without a type of legal structure that is required and that we would need to transition to. So again, 70% would like a transition, 30% are okay as we are. So what's a consideration if we do change? One of the obvious ones is, would we charge something like membership fees? And when asked, the respondents were quite alarmed that was something we were considering. However, when pressed for a monetary value split up by world income group, the majority said for low income and lower middle income, we would absolutely waive the membership fees. However, some people worked up to $100 or $300 US, but in general, it was waive the fees. For upper middle income and high income, the most frequently named response was $100, but the range was up to $500 and $1,000. But again, the emphasis was on, we don't want fees. We want the movement to continue to be inclusive. The barriers to entry would be detrimental to the people that we're trying to include and be engaged with. And so although this reflects a range of membership fees, that was the consensus to keep in mind as we think about the next pieces. Final piece that we asked about were, how do we know if we're achieving what we want to? And again, I've split it up into things that we can move forward with now, but also things that would require greater resources. So things like watching if our membership is increasing, or watching the activity on our website, or recognizing the increasing diversity in our membership, are things that we can monitor on a daily basis via our website and whoever's looking at it that day. However, the majority of things will require resources again, and these are quite aligned with our action items as is expected. So seeing an increased or at all collection of financial support and donations is recommended. Observing the formation of regional offices, observing an increase in our activities in low and middle income countries, and observing perhaps formal links with other organizations or government. These are all pieces that the membership thought would reflect our increasing capacity and our achievement of our aims, and these are currently out of our scope. So in conclusion, but this isn't really meant to be a conclusion so much as a starting point for our discussion. So this presentation was really meant to be a catalyst for the discussion that we're going to have now about how we're going to organize the future of MGMH and what we do and what we want to achieve with it and what that means for structuring it in a legal and organized type way. So these are the things that please keep in mind as we're engaging in this discussion. Our membership is varied and geographically diverse. However, we want to engage service users, people with mental health disorders, and carers, as well as government, in a more proactive way. Our aims and objectives are relatively accepted at this point. However, there is room for improvement. One of the things we can act on immediately are things like terminology. However, our action items are generally outside of our capacity at this point, but are important to recognize that that's what our membership hopes we will engage with in the future. And finally, 70% ranked as their first preference that we would make a transition into a more formal structure. However, there are challenges and opportunities associated with each of those choices. And please keep those in mind, and I'd be happy to answer any questions surrounding the content of the comments around any of these issues. And I look forward to the discussion that we're going to have. So thank you very much for having me here.